Welcome to Behavioral Health Champions, and this is an exciting new effort where we have an opportunity to talk with California lawmakers and other key stakeholders about the issue of behavioral health policy, issues related to stigma, and what some of the solutions might be for us here in this state. I'm Carmela Coyle, and I serve as the president and CEO of the California Hospital Association, and I'm joined by Jessica Cruz, my friend and colleague, who is the CEO of the National Alliance of Mental Illness California. Now, we all know that behavioral health affects all of us. 1 in 4 Californians will be touched by behavioral health. Half of us, 50% of us, will care for a friend or family member who has a behavioral health challenge. And when we talk about behavioral health, we're really talking about mental illness and substance use disorders. Now, I'm very pleased today joining us is Senator Brian Jones. Senator Jones represents the 38th District in California, and we want to thank you so much for taking time to visit with us today to talk about behavioral.
Thanks for coming in. I appreciate it.
Thank you.
I'm looking forward to our conversation.
So let's start with a little bit of background, if that's all right.
Sure.
You grew up in your district, went to school, graduated from San Diego State University with a degree in business administration. Talk a little bit, please, about who you are and how you landed here.
Okay. Well, my family moved to California when I was 10, and to Santee, California, which is where I live now with my wife and my family. My dad was a home builder in Colorado. We moved here in 1978. He came out on vacation, and things were kind of booming in California at that point in time, so he kind of on a whim put in some job applications and was actually offered more money to work for somebody building houses than he was making building houses himself in Colorado. So my parents packed up the U-Haul, the 2 kids, the station wagon, and the dog, and here to California we came. And then we moved back to Colorado one time when I was in high school. I finished high school in Colorado and then came back for San Diego State and finished San Diego State, and I've been back in San Diego ever since. So,
great.
Yeah.
Thank you.
And you have spent a lot of your career in public service.
Right.
So starting in the city council.
Correct.
And then going to the assembly, back to city council, and now in the Senate.
Right.
So tell us what kind of motivates you to pursue, both at the local and the state level, this city or government.
Sure. So, my family, so personally, and my wife also just have an attitude of community service. We always have. Growing up, my dad was always involved in, some kind of community, nonprofit or service organization like JC's or Lions Club or something like that. So I grew up with that. When I was in high school, I was in an elected office in high school, actually from junior high all the way through high school. And then in 1999, I got involved with my local politics. One of my mentors from junior high and high school had become the mayor of my hometown, and so I started paying attention to his career and what was happening there. I helped another person run for mayor and become mayor, and then there was a vacancy on the city council in 2002, so I was able to run for that and come out of nowhere and beat 2 incumbents and come in first out of a field of 9. So
Wow.
That was pretty exciting.
That's cool.
Yeah.
That's fabulous. And is public service just a part of who you are?
Yeah, exactly. My wife and I, I've been in the ministry before. She, at that point in time when we were having little kids, volunteered at the church as well, and it's just always been a part of our DNA, I suppose.
Yeah, that's great.
Yeah.
Well, Behavioral Health Action is a coalition of 50-plus organizations, statewide organizations here in the state of California, and we talk about our mission, that is to elevate, educate, and innovate around the issue of behavioral health. One of the things that we spend a lot of time talking about is the fact that we treat diseases of the brain very differently than diseases of the body, as if they're 2 separable things.
Right.
Could you talk a little bit, what are your thoughts about that and the challenge we face?
That has been shared a couple of times in my career here in the legislature, and it's resonated. I don't think that thought process, though, is as common as it needs to be. And then in reading through your materials, to get ready for today, it came, obviously, you're presenting it in your materials, and it came up again, and I thought, that's really an interesting concept, and why aren't we addressing it in the same way or have the same attitudes towards mental behavior or behavior attitudes and treating them. So I don't have any solutions, but I'm intrigued by the question, just as you are.
Well, and one of the things we spend a lot of time talking about in the coalition, we also seem to have separated sort of the delivery system and the financing system.
Right.
So this opportunity to bring things together, we'd be interested. What do you hear about as an elected official back home from your constituents? What are they saying about behavioral health challenges?
Well, I think there's a lot of different things being said about it, and that might be part of the answer to your question is why do we treat it differently and why is there this separation? And I think, Western medicine over the last 100 years has done a very good job of researching, experimenting, finding solutions to all kinds of physical ailments, and they just haven't done as good a job studying behavioral ailments. And now that it's coming up and becoming more of a talked about situation. So for example, in San Diego, I just recently joined or helped with a startup, a nonprofit organization called Cover Now Fund, which is dedicated to serving the police officer community if they're tragically or not tragically, but catastrophically injured on the job, or if an officer commits suicide and the family that's left behind. So now I'm more than knee deep into this topic of mental health, especially when it comes to our first responders.
Right.
And there's going to be, we're going to be advocating for, our first priority in this nonprofit is to care for the families, but our second priority on the mental health is how can we prevent these situations from happening in the first place.
Right. So in California, we're kind of at that tipping point, right? We have a governor who's made this as a priority.
Right.
So where do you think we're going, right or wrong? You think we're going in the right direction or wrong direction when it comes to creating kind of a comprehensive behavioral health solution in California?
Well, one of the thoughts I came up as I was kind of thinking around today's conversation, I'm a very harsh critic of AB 109, which was the bill in 2011 that Governor Brown signed for early release out of our prison system. But in preparation for this, maybe one of the good things that came out of that, which is, in every bad thing there can be a silver lining, is maybe the early release of a lot of these folks that do have some behavioral challenges, and now they're living on our streets and they're interacting with us every single day. We're seeing them. And so maybe the good thing that's come out of that is it's heightened the conversation now to, we really got to do something about this. We've really got to find some solutions to this mental health challenge, or this homeless problem is going to continue to get worse. Now, I don't believe that I don't think you can take the entire homeless population and pigeonhole into one thing. Obviously there's thousands of people, there's probably thousands of challenges and thousands of solutions. But addressing the mental health aspect of it is certainly part of it.
Well, and that takes us exactly to an area that's very important to our coalition, and that is prevention and early intervention.
Right.
Two things that you've just said. Unfortunately, many people with behavioral health challenges end up in one of two places: jail or the hospital emergency
Right.
department,
Right.
neither which is the best
Right.
place to address their issues.
Right.
How much are you hearing in your district, right? Your home. How much are you hearing from folks? Where is this on the radar screen
It's
of your
on the top of the
constituents?
list. Homelessness and mental health as it relates to homelessness, and then mental health as it relates to the crime rate. It's top of mind for everybody. I have communities in my district that have never had typical homeless challenge that today are overrun with it. And I think if you talked to most people, I think you would get a near unanimous concern for that population. But people are frustrated because they don't know how to address it. They don't know how to fix it. They certainly can't. A lot of these folks, a regular everyday citizen can't interact with them and have any kind of dialogue or conversation. So it's going to take an increase in professionals that know how to do that. Part of our criminal code is going to need to be updated. I agree with you that the hospital may not be the right place, jail may not be the right place, but living on the streets isn't the right place either. So we've got to, and prison, is probably not the right place either. But what is the right place? And how do we, I guess the word would be compel somebody who can't take care of themselves to stay somewhere where somebody can take care of them. And that, our society and our liberties, under our constitutional situation, hasn't figured that out yet. And I think that's one of the things federally and locally. How do you protect somebody's liberties, but at the same point in time protect their health, sometimes against their own will?
Sure. So our coalition is made up of a plethora of experts within their own field. And a lot of our drive is to educate people about what is mental illness, what are substance use issues, innovate on new ideas.
Right.
And we want to stand beside you and help you lift California to be its best.
Right.
How can we as a coalition help you do that?
That's a really good question I hadn't thought of, but as you were asking, and I was already kind of formulating a thought that I wanted to share, and I think maybe some of the challenge that's been up to this point in time is there's people on, I'd say both sides of the issue, but there's more than two sides of the issue, right? You've got the law enforcement, law and order folks that, their solution is to lock everybody up. You've got the ACLU and the Liberty folks that, their solution is let everybody, do their own thing. And then we've got folks like you, somewhere stuck. Okay, how do we solve this? I think if everybody just came to the table and said, none of us have the solution, right? There's whatever the solution is, none of us have figured it out. Let's all work together. Let's, like the law and order folks, work with the ACLU. You guys both admit what you've been doing for the last 20 years doesn't work. And let's have a dialogue about it. And that's really where I'm trying to position myself in all of this, coming from a law and order perspective, historically, but my family being impacted by mental health. 3 of my 4 grandparents were alcoholics and had other addictions. My wife's youngest brother was involved in the Santana shooting in 2001. He was there, on the day that happened. So that young man that was responsible for that shooting impacted my family as my brother-in-law being a victim of it. And so I recognize that what we've been doing for the last 20 years isn't working. And certainly AB 109 ended up not being a solution. Prop 47, Prop 57 added to the problems. I think some of those advocates are recognizing, whatever we did was probably it sounded like a good idea at the time, but ended up not being a good idea. And we've got to come back to the table to find some solutions. It's going to require medicine. It's going to require behavior. It's going to require, law enforcement. It's going to require more mental health professionals. We've got to really focus on this.
Senator,
I think it's going to also it's going to require the faith community to get involved and other nonprofits to have a say in it.
Yeah.
May I pick up, please, Senator, on something you just said, and thank you for sharing your family story. We all have family stories. Do you sense that it's changed? If we roll the clock back not too far, no one would talk about these things. The
Right.
stigma, the shame, so heavy. Could you talk a little bit about your perception of the stigma and what leads you to be able to voice your own experiences in your own family?
Sure. So regarding the stigma, for me, it's just I had to draw a line in the sand, and recognize and being frustrated with this community not getting the help that it needs and or real solutions being presented. And so I just had to draw, for myself personally and legislatively, draw a line in the sand and say, I don't know what the answer is, but I'm going to be out there talking about this. And I think that's, for me, it was that simple. And I think if other people just make it that simple, then we can get past, the stigma of it. I think, the headlines the last couple of days, New York Police Department's lost 9 officers since January to suicide. Well, that's not acceptable. And the people that don't want to talk about it they're just going to have to get over that and talk about it and start talking about solutions. If there's 9 that have already taken their lives in a law enforcement agency as big as they are, how many or more are contemplating it every single day?
Absolutely.
And then, leaving families behind in ruin, basically.
Right.
And I think, for a lot of us, we don't understand. It takes a lot of energy to take the life out of a human being. I mean, that's not an easy thing to do. And so for somebody to do it to themselves, there's a long process before that person gets to that point.
Right. So the prevention and early intervention
Right.
pieces of it before
Right.
they get there.
Yeah.
And officer wellness and programs that are included to make sure our first responders are also taking care of
Right.
themselves when they're responding to crisis.
Right.
It's good.
And they're interacting every day with people that are on that same thin line. I mean, they're interacting with suicidal people every single day. So there's no way that they can that not impact them.
Absolutely.
So a last question perhaps. These are very difficult issues. I think as we've had a chance to talk with our coalition members, it's all about leadership.
Right.
Is this legislature ready? Are the people of California ready? Because the numbers are just too high.
That's 2 different questions. I think I am convinced that people of California are ready to have this conversation. You've got LA City with 41,000 homeless people. You've got San Diego County with more than 8,000. You've got mountain towns that have never experienced homelessness now having that challenge. So I think for most Californians, it's forefront of thought for them. The legislature, if we can get to the point where, like I said earlier, everybody just comes to the table and recognize whatever solutions we've come up with to this point aren't working, and we need to all kind of put our heads together, and we're going to be creative, and some of the ideas are going to resonate with one group and not another group, and just say, okay, that's fine. It's not going to resonate, but we got to try it because nothing else has worked.
Well, we'd like to thank you. And in closing, this Behavioral Health Champion Series is a production of the Behavioral Health Action Coalition of more than 50 statewide organizations really coming together to see if we can make a difference. Senator Jones, we thank you so very much for
Thank you.
taking time today to talk with
Sometimes
us.
I feel like I should go back and get my master's degree in behavioral health, but I don't think I'd pass the classes.
We need you here. We need you here.
You have your lived experience, and that makes you an expert.
Right.
So
We
Thank
need
you.
you here. Thank you so much.
You bet. Thank you.
thank you.